I'm Greg Bizignani, and I'm an orthopedic surgeon with Excela Health Orthopedics. Very rarely do I schedule a joint replacement for the first time the patient comes in the office. It's usually an evolution of things. And basically the patient comes to the office and first of all we identify the fact that they're having significant discomfort and pain because of an arthritic joint. And then we'll talk about the options and go through the conservative things. And usually we'll try conservative treatment first, from exercising to weight loss to injections to medications. And then if you get to the point where a person is doing those conservative measures and they're still having significant discomfort to the point that it's affecting their normal daily activity, then we'll start talking about a joint replacement. I always tell my patients, I think the most important thing you can ask yourself is, can you live with this joint the way it is? Is it affecting your life? Is it changing the way you want to do things, such as you can't go to the mall, you can't play ball with your grandkids? And once you get to a point when those things start affecting the normal life, especially if they're having pain at night, that's usually the last straw when we start talking about, okay, what's the next step? And the next step becomes a joint replacement. Well, the first thing you have to be able to do is you have to be able to tolerate the surgery. And that's from a medical standpoint, your heart, lungs, and it's a team approach for a joint replacement. We won't perform a joint replacement on somebody that hasn't seen their medical doctor first and said that they're physically capable to tolerate a joint replacement from a heart and lungs. The second thing we want to do is we obviously want them to be in a good enough shape to tolerate not only the surgery but the rehab that's afterwards, which is often more stressful than the surgery itself. So we want someone to be in good shape, not only at a good weight to decrease the risks of surgery, but also physically fit to be able to tolerate the surgery and the rehab afterwards. This is literally an actual joint replacement. This is the femoral component that goes on the top bone. We literally, not to be too graphic, we literally shave or cut the arthritis off at the end, and then we sort of will cap the bone like a tooth. We do the same thing similar on the tibia bone, which is the bottom bone, and then the inner piece is the plastic polyethylene, and this goes together and actually becomes the new knee replacement. We've worked for years at Excela, and this is a multitude of people, from the physicians to the therapists to the nurses, and coming up with a program. And we kind of educate the patients from start to finish. The patients that do the best are the ones that are educated and know what to expect. And through our joint class, we're able to do that. We're able to teach the patients the exercises that they can do to make themselves stronger so they can work on it before surgery and know what to expect after surgery. And not only for the patient, but for their spouse or significant other are involved in the whole process. So it's a really good program. The patients really enjoy it, and it really benefits them throughout the whole program. We're one of the highest ranked hospital facilities in all of Western Pennsylvania. I think the people in the program have worked very hard, and it shows in how well the patients do after their surgeries.